and welcome. We're excited to have you join us today. In this video, we're going to be covering everything you need to know about genicular artery embolization. We call this GAE for short. But first, we're going to do an overview about what arthritis is, and then share with you some new details about arthritis that I promise you've never even heard of. So we're all going to learn a new word today. So we'll also cover how this procedure treats the real source of your inflammation and pain, what you can expect during and after the procedure, and finally, the safety and expected outcomes of the GAE procedure. So first, let's take a closer look about what's happening inside your arthritic knee. So you've probably all heard this before. Osteoarthritis is often called wear and tear arthritis. There's lots of different types of arthritis, but this is the most common form of arthritis. Osteoarthritis is more than just simple wear and tear though. It's actually a very complex process that starts when the cushioning between the bones, your cartilage, begins to wear down. So the thinning of the cartilage is actually what we call arthritis. That's what arthritis is. This breakdown leads to a number of symptoms. All of you have felt these symptoms at one point or another. Obviously the pain, the bones rubbing against the bones, the grinding, the popping, stiffness in your joint like when you wake up in the morning, swelling. This typically gets worse the longer you have arthritis, and this was what we're really aiming to treat with the GAE. Bone spurs are those little tiny growths on the end of the bone that reduce your range of motion and create more friction and damage and reduce the overall function of your knee. Here's this new word that we're going to talk about. This is what you've probably never been taught. So osteoarthritis involves something called angiogenesis. This is the growth of abnormal new blood vessels inside the joint. This is the primary source of your inflammation and pain, and this is exactly what GAE is going to treat. Now you're probably wondering, well, why does angiogenesis happen in the first place? What does it have to do with my arthritis, and what does it have to do with my knee pain? So it seems counterintuitive that the body would create these blood vessels that actually cause more damage and make the problem worse. Well, angiogenesis is actually stimulated at the onset of every injury. Whether you scrape your skin or have knee arthritis, this is how our body heals. So think of this like your body sending out an SOS message. It's calling for more blood vessels to be made to bring in nutrients and oxygen to help repair whatever damage it is, whether it's a cut or arthritis. So in your case, as the arthritis continues to get worse, messenger cells called cytokines are released. This is what triggers the inflammatory response. These cytokines also signal the body to start making these new blood vessels. It does this by stimulating a specific growth factor known as vascular endothelial growth factor. This is how the body starts producing more and more blood vessels. So the problem is this brings on even more and more inflammation, and guess what? It brings about more pain, and then the vicious cycle starts over again. So it's like your knee, it's trapped in this cycle of inflammation that it just can't escape. So as you can see, it doesn't sound so simple. It's not just wear and tear. So these new blood vessels, they're not always behaving like they should. They're not doing the intended purpose of just healing the tissue. They become overly active and they contribute to a number of problems that actually make your arthritis worse. So let's talk about three main problems that are caused by all these abnormal blood vessels. So number one, we've already talked about it, increased inflammation. Those extra blood vessels are releasing inflammatory substances that make your pain worse. This is called upregulation. So we're upregulating the inflammatory process. That's bad. Number two, cartilage damage. These blood vessels release enzymes that actually break down your cartilage. This is why your arthritis gets worse with time. The longer you have inflammation, the longer you have arthritis, the more it eats up the tissue. It's like acid eating the joint or eating the cartilage. So number three, pain. These angiogenic blood vessels also stimulate nerve growth factors. This is a substance that promotes the growth and increased sensitivity of your existing nerves. That makes it more likely to fire the pain signals. The overall effect is a lowered pain threshold, meaning that things that wouldn't normally cause pain, well, now they do. And you're feeling it. The longer you have arthritis, the more all this compounds and gets worse. So now that you know a little bit more about arthritis, and you know what angiogenesis is and the effect that these troublemaking blood vessels are having on your knee joint, this is where this procedure comes in. This is where GAE shines. We are attacking these abnormal blood vessels. So GAE is a safe and highly effective, minimally invasive procedure. This targets the abnormal blood vessels. Remember, this is the source and primary cause of your pain and inflammation. All right, so let's talk about how this works. So under X-ray guidance, we are guiding a tiny catheter down the blood vessels of your leg into the arteries that supply the knee joint. There are 8 main arteries that supply your knee joint. These are called the genicular arteries. Hence the name, Genicular Artery Embolization, meaning we're blocking these arteries, we're blocking the blood flow. Not of the main arteries, but again, of the angiogenic blood vessels. So we're gonna talk about that and explain that in detail. So after guiding a microcatheter into each genicular artery, or at least every one that we can get into, we're gonna inject a small amount of contrast. What we're looking for is an abnormal cluster of these vessels. And what we see is these abnormal vessels, they light up on the X-ray. They show us something called hyperemia. When we see this, we're gonna proceed to treat it. This is how we treat the abnormal blood vessels of the joint, to stop the inflammation and to stop your pain. So the hyperemic vessels, how we treat it is we're gonna block the blood vessels. We're gonna turn off the blood flow to the blood vessels. So we do this by injecting little tiny microscopic gelatin beads. They're like little tiny spheres. I like to use the description, they're like injecting tiny little grains of sand made out of gelatin. So think of this like damming a river or damming a stream. We're stopping the flow of water. So in this case, we're stopping the flow of blood. So this is where we tend to start losing patients, because we're talking about blocking blood flow, and that probably sounds a little bit concerning. So I want to make sure we're clear that we are not blocking the main supply of blood to your knee joint. We are only treating the abnormal extra vessels that are responsible for your pain and inflammation. Once these vessels are gone, your pain and inflammation are going to be substantially better. So think of GAE, it's like pruning a tree. Just like removing the overgrown or the unhealthy branches, this helps the tree actually flourish. This is healthy for the tree. So it's the same thing in your knee joint. We are blocking only the problematic blood vessels, allowing the healthier blood vessels to thrive and support the surrounding tissue. All right, so now you're probably wondering, well, this all sounds great and all, but how safe is this procedure? Because again, it might sound a little bit scary that we're going inside the blood vessels, we're blocking blood flow, we're doing all this stuff that of course you've never had any exposure with and you've never even heard about this procedure. GAE is extremely safe. In some ways, we consider it even safer than a joint injection. There are some patients that just aren't good candidates for this process. So these patients might be really sick with peripheral artery disease. They may have calcifications in their arteries. They could have uncontrolled diabetes. They might have uncontrolled high blood pressure, even on medications. These patients we're gonna screen away from this procedure. And frankly, those patients aren't good candidates for knee joint replacement either. All right, so now we're gonna talk about the access for the procedure, how we get into the blood vessel. The procedure is gonna be performed through a blood vessel in the upper thigh at the groin. The access is barely bigger than a needle used to draw blood, so it's very small. And because the access is so small, there's no need for an incision, there's no stitching, and guess what? There's no scarring. Within a week, you will not even be able to find where we did the procedure at all. So this is very minimally invasive. We do the procedure right here in the office where we're shooting this video today. All right, so let's briefly talk about some potential side effects. Every procedure has risks. Every procedure has potential side effects. The really good news is the potential side effects, number one, are rare, and number two, they're self-limiting, meaning they're gonna resolve on their own within about 10 to 14 days. This is without any treatment whatsoever. So in the worst case scenario, this process is all going to improve on its own. So the most common side effect of the treatment is called skin mottling. Skin mottling is an appearance where it looks like we might have left an ice pack on your leg or on your knee for a period of about 30 to maybe 45 minutes. The skin's going to look super cold. If this were to happen, that skin change is going to get better on its own, like I said, in about 10 to 14 days. Secondly, and we've seen this in the literature, this is extremely rare. It's extremely rare cases. It's possible to get some very small ulcerations of the skin. So both of these conditions, and the reason why they can potentially happen, is the genicular arteries also help supply the skin. So when we're in the genicular arteries and we're looking for hyperemic changes and we're injecting these little particles, sometimes we know and we can see the branches go into the skin. We know that when we inject these particles, they are going to treat what we need them to treat, but it's also going to treat a little bit of the skin. And so it can create a little bit of ischemic change or a lack of blood flow to the skin. Sometimes this is just an acceptable part of the procedure, especially considering we know it gets better with time all on its own. So, but please remember, these are rare instances. Even if you were to experience one of these side effects, everything will resolve on its own with time. The complication rate for GAE is said to be less than 1%, and this is on all the cases across the country and across the globe. All right, so we're gonna cover a few common questions that we get about the GAE procedure. Number one, what are the beads? Do the beads dissolve? And can the beads get to my heart and lungs? These are all great questions. So the beads have been used in embolization procedures since the 1970s. They're made out of gelatin, they're flexible, they're clear, they're non-toxic and non-metallic. So you'd never even find them. Once the beads are injected, they stay stuck basically in the skin of the blood vessel, and they'll basically stay there forever. As the blood vessel dies around it, it's gonna get trapped in the body, and you'll never even know they're there. You can't find them on ultrasound, you can't see them on x-ray, you're not gonna set anything off like an alarm going through the airport. So this is basically nothing to worry about. So they are non-toxic, meaning they're not gonna interfere with your body. In the last 50 years since embolization treatments have been going on, there's never been shown to be any cause of any long-term side effects on any patient that's ever been reported. So nothing to worry about there. So can the beads get to my heart and lungs? This is Dr. Smith's joke, so I won't take credit for this, but he likes to joke that the beads are not salmon and therefore they can't swim upriver or upstream to your heart and lungs. So this is a relief for a lot of patients. Remember the physiology of the heart. The heart is pumping blood away from the heart, and veins carry blood to the heart. So vascularly, when we're down in the knee joint, the beads can only go distally, meaning they can only travel down away from the knee to the foot or into the skin. They can't travel all the way back up to the heart and the lungs. So to quell most of your anxiety about a procedure, and I get it, everybody gets a little bit excited when it comes to procedure day. They don't really know what to expect, and everybody's concerned about pain. So this is probably the most common question: is the GAE procedure painful? One of the best things about GAE is the treatment does not hurt. The only discomfort you will feel is an initial pinch and burn from the lidocaine to numb the skin at the groin. This is the skin over the vessel where we have to access that little access that we talked about earlier. So this is it. Once this is over, you might feel a little bit of pressure when the sheath is introduced to the blood vessel, and that's about it. So we're not talking about any major discomfort or pain whatsoever. After that, you will feel some sensations of warmth. This is the contrast being injected through the catheter. So when we're looking for all these vessels, we're looking for the angiogenesis, we're looking for the hyperemia, we inject contrast to be able to see this on the x-ray. You're gonna feel a little bit of warmth when that dye is injected. This is normal and nothing to be concerned about. It's not painful at all. So one last thing to reiterate, blood vessels also do not have nerve endings. So you can't feel the movement of the catheter through the blood vessel at all. So there's nothing sharp on the end of the catheter. So we won't be poking and prodding on you. You're not gonna feel anything uncomfortable during the treatment. You're just basically gonna be lying there. You're gonna be relaxed with a little bit of anesthesia. You'll feel like maybe you had a margarita or two. So this is a very easy process for the patient. We wanna make you as comfortable as possible. We want this to be a breeze. We want you to have a fantastic experience. All right, so let's talk about procedure day. So this is a few important things you need to know what to expect the day of your procedure. So number one, you will need a driver. You'll need a driver both to and from the office. You cannot take an Uber. We can't throw you in an Uber after the procedure, especially after you've had sedation. It's just a liability thing. So please arrange for a driver to take you to and from the office. Please do not eat anything after midnight the night before. Technically, it's 8 hours before the procedure, but just to be safe, let's not eat anything after midnight. You can have water and black coffee up to 2 hours prior to the procedure. But I said black coffee, so that means no cream, no sugar. So if your procedure is scheduled at 8 a.m., you can wake up maybe 5:30, have a cup of black coffee, have some water, take all of your normal medications. This is very important. When I say normal medications, we're going to talk specifically about blood thinners, and we're going to talk specifically about metformin if you're diabetic. So wake up, take your blood pressure medications. This is ultra important. Take your normal medications. So if you're on a blood thinner like Eliquis, Xarelto, Pradaxa, we're going to have had you stop that 2 days prior. And if you're on metformin, we're going to have you stop that the day before the procedure. You can resume the blood thinners after the procedure. You can resume metformin 2 days after the procedure. But again, if you have any questions about this, call our office. We'll go over this with you again. I'm sure that we've probably talked to you about this already. So the treatment is only going to take about 30 to 60 minutes from start to finish. So it is a relatively quick procedure. It doesn't take a long time. We are going to IV sedate you, so we're going to help you relax for the procedure. It's really just to take the edge off. We're not using anesthesia to help you with your pain. Remember, we said the GAE procedure is not painful at all. We just want you to be comfortable for the procedure. We want you to relax, and we need you to be still on the machine so we can take some really good pictures with the x-ray. This helps us do our job better. All right, so what can you expect post-procedure? Of course, we're all excited about how you're going to feel. So initially, you might feel a little worse before you feel better, but I mean a little worse, not like you're going to be in severe pain after the treatment, but the knee can ache for a few days. So if you feel some mild to moderate increase in your pain, this is totally normal. I usually recommend patients use Voltaren or diclofenac cream on the joint. This can help with any post-procedure discomfort. If you can or able to take NSAIDs, you can take oral NSAIDs like Motrin, ibuprofen, or naproxen. But you are not supposed to take these if you have other reasons you can't take them, such as previous history of gastric bypass, previous history of a bleeding ulcer, uncontrolled diabetes, uncontrolled high blood pressure, chronic kidney disease. So if you have any of these types of past medical history, do not take ibuprofen, naproxen, or Motrin. It's much safer for you to take Tylenol, which is just a simple analgesic. With regard to dosages, it's safe to take up to 3 to 4 grams of Tylenol a day. That's 3,000 to 4,000 milligrams of Tylenol per day. That's the safety limit. Most people take a lot less than that, maybe 1,000 milligrams once every 12 hours. So you're not gonna need that much pain relief after the procedure, but just so you know. All right, so now let's get into why you're all here. Of course, your pain relief. What can I expect in terms of how well is this gonna work for me? In the literature, 80+% of patients should experience significant lasting results for a minimum of 1 to 5 years from a single treatment. So can this treatment be repeated again? Yes, it absolutely can. So if we had to repeat the treatment later on after these blood vessels grow back, of course it can be treated later as well. But I want to quantify what significant relief mean. Okay, significant relief means between 50 to 100% improvement in your pain and your function. That means you're doing more activities with less pain. So we're seeing a dramatic change in the way people live their daily life. So getting back to activities that they haven't been able to do in years. This improvement level is consistent with what we have seen doing GAE for the last 2 years. So as you can see, this is a very effective and also lasting treatment with minimal risk. So GAE is currently the most effective and long-lasting non-surgical treatment option for knee arthritis currently available in medicine today. Most patients are seeing improvement in their pain within 1 to 3 weeks, so very quickly. Sometimes patients will experience almost immediate relief, like the next day they feel substantially better, but expect your pain to get a little bit better with time. It can take longer for some patients. I've seen patients where it takes 6 weeks to really take good effect, but that's kind of not the standard. So overall, you should see faster pain relief than you probably did initially when you were doing gel injections before. probably virtually everybody that's watching this video today, I know you've had a steroid injection and you've probably been through the gel injections also. So in close, I want to thank you all very much for watching our educational video today. I hope this has helped answer most of the questions about how this treats arthritis pain and of course the relationship of the abnormal blood vessels and how that contributes to your arthritis. We look forward to seeing you on procedure day. If you have any more questions, please reach out to the office. One of our providers will be happy to speak with you about the procedure in more detail. We hope you're as excited as we are. We love seeing the results of patients after having this treatment. We love to see you getting your life back. So GAE is breathing life into arthritis treatments. We've had a huge gap in the paradigm treatment of arthritis from injections. The only other step was jumping straight to a knee replacement or to have surgery. So GAE is filling the gap for a lot of patients. So we hope you enjoyed this video today. Please like and subscribe. Check out our other videos on our YouTube channel. Thank you, and we look forward to seeing you soon.